Further debate, the member for Scarborough-Guildwood.
Thank you, Speaker. It's an honour to rise in the House today to speak to this motion about a public inquiry. And, Speaker, we have the Public Inquiries Act as part of the toolkit in this province because there are times when we need to understand the facts and there are times when we need to do that in an independent way. And as I listen to the rounds of debate this afternoon, I do not hear any disagreement with that the facts in this matter require investigation. But why does it need to be independent? Why does it need to happen in a way that respects the transparency? Because we owe it to those that have been impacted. We owe it to those families to seek the answers that they are looking for. And in fact, you know, the government's hesitation on the length of time, part of the tools in the Act gives the government that ability, that power to fix the date. So there is no concern for speed in response because the ability to fix the date is in the hands of the government. The government has said that they knew the risks. The minister said that many times. And on March 11th, I raised in this House my concern for COVID-19 for long-term care. And Speaker, the reason I raised that concern and I asked about community spread and whether or not we were restricting access to those facilities, because I understood that this was a respiratory virus. And I understood that in a respiratory virus, the most vulnerable people are the elderly and those that are in long-term care. You see, in 2003, when we experienced SARS, the first incident of SARS occurred in Scarborough, at the Scarborough Grace Hospital. And I was responsible at that time for hundreds of frontline workers at Goodwill Industries. And every morning, my team and I, which included the president of the organization, would talk about the facts. And the information that we were provided was provided by public health and by the government. And we relied on that. We relied on that information to keep our people safe. So I asked that question in the House on March 11th because I wanted to sound an early alarm. I wanted to give the government confidence, the ability to be bold, and to make clear and decisive communications known to people so that they can take the necessary precautions. Sadly, nearly 3/4 of the deaths from COVID-19 in Ontario has been in long-term care facilities. Thousands of families are in mourning, and I know that because in my community in Scarborough-Guildwood, Seven Oaks was one of the earliest outbreaks, Altmount. These facilities were just ballooning with cases. And we asked the government repeatedly about testing, about PPE, about protection of workers, and there was a delay. Why was there that delay if you knew the risk early on? Why was there that delay? And families are now in mourning. They were not there with their loved ones when they passed. They weren't able to hold their hand and say a prayer or to give a hug of comfort. They deserve answers. They deserve to know that their loved ones have not died in vain. Mr. Speaker, it is our duty and our obligation to give answers to these families and to these workers who have also lost their lives. I want to just say to those workers, to the tragic loss of Christine Magdangarian, to Arlene Reed, Sharon Roberts, Brian Beattie, and that one other healthcare worker whose name has not been made public. To their families who are mourning those losses, we are giving you our heartfelt condolences. And as a legislature, It is our duty to do the right thing on their behalf. Thank you, Speaker.